Did you know that one cigarette has a shocking effect on your heart? Everyone knows that smoking is bad for your health. However, not many people know specifically how one cigarette affects our heart. In this article, we will learn more about the shocking effect of one cigarette on our heart. Immediate effects. From the moment you smoke a cigarette, immediate changes occur in your body, especially your heart. 1. Increased heart rate. When you smoke a cigarette, your heart rate increases immediately. On average, your heart rate increases by 10 to 20 beats per minute. This puts additional strain on your heart. 2. Increased blood pressure. Nicotine is a powerful vasoconstrictor. Smoking a cigarette can temporarily increase your blood pressure by about 20 millimeters of mercury. This puts more strain on your heart. 3. Reduced oxygen supply. Carbon monoxide in cigarette smoke reduces the blood's ability to carry oxygen. Even one cigarette can reduce your blood's oxygen saturation by up to 15%. 4. Vasoconstriction. Nicotine constricts blood vessels. This causes the heart to work harder to pump blood. 5. Increased risk of arrhythmia. Chemicals in cigarettes can interfere with the electrical activity of the heart. This increases the risk of arrhythmia. Short-term effects. The effects of one cigarette continue immediately after smoking. 1. Increased risk of blood clots. Cigarettes make the blood stickier, which increases the risk of blood clots. This increases the risk of heart attack or stroke. 2. Decreased vascular endothelial function. Chemicals in cigarette smoke decrease the function of vascular endothelial cells. This reduces the ability of blood vessels to expand and increases the risk of atherosclerosis. 3. Increased inflammatory response. Cigarettes promote inflammatory responses in the body. This accelerates vascular damage and atherosclerosis. 4. Abnormal lipid metabolism. Smoking decreases HDL good cholesterol and increases LDL bad cholesterol. This increases the risk of cardiovascular disease. 5. Increased insulin resistance. Smoking increases insulin resistance. This increases the risk of type 2 diabetes, which is a major risk factor for cardiovascular disease. Long-term effects. The effects of one cigarette can be cumulative and lead to serious long-term consequences. 1. Increased risk of coronary artery disease. Continuous smoking increases the risk of coronary artery disease by 2 to 4 times. This is a major cause of myocardial infarction. 2. Increased risk of heart failure. Smoking weakens the heart muscle and increases the risk of heart failure. 3. Development of peripheral artery disease. Smoking is a major cause of peripheral artery disease. This reduces blood circulation in the legs and can lead to amputation in severe cases. 4. Increased risk of aortic aneurysm. Smoking weakens the walls of the aorta, increasing the risk of aortic aneurysm. 5. Increased risk of sudden cardiac death. Smokers are 2 to 3 times more likely to experience sudden cardiac death than non-smokers. Harmful substances in cigarettes and heart health. A single cigarette contains more than 7,000 chemicals, 69 of which are known carcinogens. Among these, the following are those that are particularly harmful to heart health. 1. Nicotine. Nicotine constricts blood vessels and increases blood pressure. It also increases heart rate and increases the risk of arrhythmia. 2. Carbon monoxide. Carbon monoxide reduces the blood's ability to carry oxygen. This causes the heart to work harder. 3. Tar. Tar builds up in the lungs and interferes with oxygen exchange. This in turn puts a strain on the heart. 4. Nitric oxide. Nitric oxide damages blood vessels and promotes arteriosclerosis. 5. Free radicals. Free radicals in cigarette smoke damage vascular endothelial cells and increase oxidative stress. Interaction between smoking and other cardiovascular risk factors. Smoking interacts with other cardiovascular risk factors to further amplify the risk. 1. Hypertension. When smoking and hypertension are combined, the risk of cardiovascular disease is much higher than the simple addition of each risk. 2. High cholesterol. Smoking accelerates the oxidation of cholesterol, accelerating arteriosclerosis. This has a synergistic effect with hypercholesterolemia. 3. Diabetes. Smoking significantly increases the risk of cardiovascular complications in diabetic patients. 4. Obesity. When smoking and obesity are combined, the risk of cardiovascular disease is further increased. 5. Stress. Smoking further aggravates the cardiovascular effects of stress. Effects of secondhand smoke. Secondhand smoke also has serious effects on heart health. 1. Increased risk of coronary artery disease. When non-smokers are exposed to secondhand smoke, the risk of coronary artery disease increases by 25 to 30%. 2. Acute cardiovascular effects. Even 30 minutes of exposure to secondhand smoke can reduce the vascular function of non-smokers to the level of smokers. 3. Cardiovascular health of children. Children exposed to parental smoking are at higher risk of cardiovascular disease as adults. E-cigarettes and heart health. E-cigarettes, which have recently become popular, can also pose a threat to your heart health. 1. Effects of nicotine. Most e-cigarettes contain nicotine, which can have a negative impact on your cardiovascular system. 2. Risks of fine particles. Particles emitted from e-cigarettes can be harmful to your lungs and cardiovascular system. 3. Risks of new chemicals. The long-term effects of some chemicals contained in e-liquids are not yet fully understood. Benefits of quitting smoking. Your heart health begins to improve immediately when you quit smoking. 1. Immediate benefits. Your heart rate and blood pressure begin to normalize 20 minutes after quitting. 2. Short-term benefits. After 1 year of quitting, your risk of heart disease is reduced by half that of a smoker. 3. Long-term benefits. After 15 years of quitting, your risk of cardiovascular disease drops to the level of a non-smoker. How to quit smoking. Quitting smoking is not easy, but the following methods can help. 1. Nicotine replacement therapy. Nicotine replacement therapy using nicotine patches, gum, sprays, etc. can be effective. 2. Medication. Medication prescribed by a doctor can help you quit smoking. 3. Behavioral therapy. Cognitive behavioral therapy or smoking cessation counseling programs can help. 4. Exercise. Regular exercise can help reduce the stress that comes with quitting smoking. 5. Support groups. Joining a smoking cessation support group can help you stay motivated and share information. Conclusion. The impact of a single cigarette on our heart is much more serious than we think. From immediate effects to long-term risks, smoking threatens our heart health in many ways. But the good news is that quitting smoking can significantly reduce these risks. Your heart and your life are much more precious than a single cigarette. If you find it difficult to quit smoking right now, why not start by cutting back? Small changes can save your heart and your life. A healthy heart is the foundation of a happy life. Protect your heart from cigarettes. Start today. Your heart and your life will be healthier and happier. Don't miss this important health information. Subscribe, like, and set notifications right now to be the first to receive more useful information about smoking cessation and heart health. Your interest is the driving force behind creating better health content. Let's create a healthy future together.